Hey everyone, I'm Eve Lee, Executive Director of AOPA, and we're here this morning to talk about a brand new partnership and program that we are launching to members. I have a very important partner here with me. Why don't you introduce yourself?
Hi, I'm Terry Borman. Eve, so good to be here, and it's so great to talk to everybody from AOPA today.
Well, we're happy that we can make time for this and really tell our members about what we're hoping to accomplish with this new program.
Absolutely.
Can you say a little bit about your background and your background in this space in particular, the association space?
Sure. Well, I've been in the employee benefit space for 25 plus years. Been saying 25 plus for a while.
Yes,
now, so.
understood.
But over the last couple of years, I focused specifically in putting together programs for associations like AOPA, because most of these associations are smaller size businesses, if you will, and the cost of health insurance has gotten so out of control that this is a way for them to band together and save a great deal of money while providing their employees with excellent programs. So that's been my pure concentration with Kaler Fleming and our parent firm World Insurance for at least the last 2 years. And AOPA is the 8th association that we've rolled this program out to, and we're at an exciting stage right now.
Well, we're pretty excited as well. Our members are very familiar with Kaler Fleming. And so we were happy to make that introduction. We did a survey to our members in 2019, most of which, as you mentioned, are small business owners and in this space. And we did a survey, and one of the future benefits that they were very interested in, one of that would return a lot of value to their practices and their businesses, was health insurance, being able to offer competitive, great coverage health care for their employees. And so when we talked to Kaler Fleming and we made our partnership with you, it was really a good match for us and our members. So can you let's talk about where we are in the process, what we've done up until now.
Sure.
To kind of make this a good offering for our members.
Well, with a great deal of effort from you and your team, we reached out to a lot of those members that previously expressed interest in putting together a program. And what we did was we collected census information so that we get an idea of what the group looked like. From that, we've been able to set up rate tiers. And so now we're at the point where we're going to actually roll the program out and start going through the enrollment process for January 1st effective date. And we have all the various rate tiers. So the next step is for those member organizations that have some interest in finding out whether or not this could be a good fit for them. We'll have links to a secure HIPAA certified portal where we'll ask their employees to complete a little bit of information on themselves and any family members that they want to cover. And then from there, we'll let that organization know what rate tier they would fit in, and they can pick the plan design that works best for them. And assuming that there's a savings, and there will be in most cases, then they can choose to go forward or not go forward with the program if it works for that organization and their employees.
Well, and I think this is really great timing. I know today is October 25th.
Yes.
I know AOPA, with our employees, we're going through open enrollment right now. And so the idea hopefully is that we're giving some information to our members that would be valuable during this decision-making time. I know that we, and thank you for everyone that filled out the census for us. That was really helpful for us to be able to set these rates, as you mentioned. Can you give a sense of what kind of savings might happen, or even just a preview? Because I know it'll be different for everyone, but
it's going to be different for everybody. But for the healthiest groups, we have single rates as low as $300 a month. We have family rates as low as $915 a month. Now that's more of a bare bones plan with more out-of-pocket costs. But even with our richest plans, the single rate is $570, and the richest plan available. And that's a plan with a very low deductible, low copays to go see a doctor with great benefits. So 570, I don't know. It's going to vary depending on where the organization is in the country. Absolutely. But in the New York, New Jersey area where I am, that type of plan could cost $1,000 very easily in the small group marketplace, which is really where the biggest opportunity here is. So there's two things to think about as organizations look at these programs and determine whether or not it's a good fit for them. One is the initial savings. And so for some companies, Eve, I expect that the savings will be 35, 40%. For others, it won't be that high, but there still should be savings for the vast majority of the groups. But the big deal to me by putting all these companies together and banding together is what's going to happen a year from now at renewal time. In the small group market, every year it's kind of a roulette wheel.
Yes.
What's our increase going to be this year?
Yep.
Is this a year with 7%, or could this year be the year with 17%? Or in the last couple of years, we've seen increases 20+%. Well, by spreading the risk out among so many lives and getting looked at as a large group, and then with the medical management programs that we have in place that provide better value and better services for the members while saving the plan money, our increases for some of the associations that we've had on the books for over a year, our increases this year were coming in around 2%. And that is below market right now.
I was actually just going to ask you about that. What kind of experience with some of your other groups that you've worked with would be the increases that they're seeing or the benefits? I think that's a great value add to not even have to, as a small business owner in this time of year, what we hear over and over again, we have to go through open enrollment, we have to go and shop around, and it just is really difficult to do that. And it takes a lot of organizational drain to do that, and to have it already pre-planned, already set up is really helpful.
And so it does two things. In the business world today, the cost of providing health insurance to employees has become the second or third biggest expense on a P&L statement. And then in the small group market, with the not knowing from year to year, it makes it very difficult for those small businesses to budget. Because let's face it, we're going to pass those costs along to our clients for the most part, or we're going to reduce the benefits and pass more costs along to our employees. So by doing it this way, it's far easier to budget, and you don't have to keep going back to your employees and saying, "Well, we got to get more this year. We got to get more," and it's hard to keep employees if we keep.
Well, that's what I was just going to say, is that with the onus more on employers to work with their employees and to provide value and benefits, to keep employees engaged and committed to them, to be able to offer really comprehensive healthcare at a marketable rate is critical. It's critical because they will go somewhere else.
They will, absolutely. I mean, it is for people that are looking for work right now. It's a buyer's market. It's very easy for people that say, "No, I don't want to work for you because your benefits aren't good enough, or the pay scale isn't high enough," because there are so many people looking for employees right now as we recover from this horrendous pandemic that we've been dealing with for the last, seems like forever, doesn't it?
It does. So tell me, what can people expect throughout the year in terms of if they have questions, if they have issues, if their employees have issues? Can we talk a little bit about what they can expect once they sign up and they get their competitive rate, and when it starts January 1, what does that relationship look like throughout the year?
Yeah, well, that's another great thing, is people will start to get the service that the large companies are used to, a more personalized service. They'll have individuals that they can call to get their questions answered. So yeah, every member that decides to participate in the program, they're going to get their medical ID card, and on the back of that is going to be an 800 number for providers to call, as well as the employee to call if they have questions. But the employer also knows that if an employee doesn't feel satisfied getting their questions answered by that 800 number, they know that they have phone numbers to call at Taylor Fleming. They have Todd Mel, they have Terry Gorman, they have other people that will be assigned to work on this program, that they can reach out and we can intervene on their behalf and get satisfaction and get service to those employees more quickly than getting on an 800 number and not knowing who you're going to talk to day after day, which is what it is in the small group insurance market.
Yep. I know that as a recipient of healthcare, it really is daunting to just have to call an 800 and ask about, my daughter just turned 19. Is she still on the plan? Does she have the same coverage? Is there something I need to do? It's really helpful to have that personal connection with anybody
True.
that doesn't, even if their number starts with 800, but I know I can call to it.
Right.
You know what I mean?
Absolutely.
That is very important to me as these life events, I think they're called, happen in mid-year. And you're just not sure what the impact is.
True.
So that's helpful.
And there's another service that by you guys putting this program together for all of your organizations, there's another service that's also important for your members to understand. And that's what we call either concierge or medical advocacy service. And this is an individual at our third-party administrator that can help people work their way through the very confusing maze of dealing with the healthcare system. I mean, there's some diagnoses that people will get throughout their life that A, are incredibly frightening, and then B, are incredibly confusing. And what do I do? And where do I go? And there's 4 different treatment options. What's the best one for me with my age, my condition?
That's right.
And
my job, my work.
Yep. My work,
yep.
My location, and then who are the best providers in the area to help me deal with that, whether I decide I'm going to go the surgery route or the radiation route. Well, we have that advocacy service where an individual can call somebody and they'll gather their information for them, and they'll walk them through the entire process. And these are the recovery rates for 10 years with this type of treatment versus this type of
that
treatment.
Is very helpful.
And then here are the best providers in your 20-mile radius and the hospitals that provide these services. Here are the ones that have the best records, the best recovery rates, and all that type of stuff. And that is something that you don't get in the small group market. But it's commonplace in the large group market.
Yep.
And now you're giving your member organizations large company benefits, but at deeply discounted costs.
And we see so often now patients have to be advocates for their own healthcare. You can be less dependent on, because you don't just see a primary care physician.
No.
There's a wide array of specialists that you see, and you never are really sure what paths to take. So that's really helpful. We have spent a lot of time this summer and into the fall learning about orthotic prosthetic care.
Yes.
And coverage. And you have spent a lot of time with us learning about our members' business. And that has been really critical in knowing our business and our members' business, whether it's on how they shop for healthcare for their employees or how they serve their patients. Right. I think has been very critical.
It's been an education for me. It's been great. It really has.
So can you talk a little bit about, you've been very open to learning about our business and the members' business. How will that impact the service that you provide and your ability to kind of connect with our member companies?
With this program, this is what's known as an ERISA benefit. So this is an AOPA specific program. And so we actually write the language for the plans. This is how these type of procedures and these type of issues are going to be covered. So working with your team, and you guys doing a great job of educating us, we went to the stop loss providers who are providing the insurance with this program and said, these are the terms that we need for orthotic and prosthetic treatments, et cetera. And so these are probably the richest O&P benefits of any program out there will be through this program.
Well, and we spent so much time doing that, not just because we wouldn't want to offer our members a plan that they wouldn't advocate for their own patients.
Right.
But we do know that we're a profession that has a very close connection with their patients, whether they are an amputee or whether there was one in their family, or there's a very close connection. And so we appreciate that kind of work that you all put into that. What am I not asking? What other with your 8 other organizations that you've launched plans with, even in just a short amount of time? What other kinds of issues have we not talked about this morning?
Well, it's kind of now what's the process of moving forward?
Yes.
So, we're going to get out on your website, and we'll also get out via emails, et cetera. We'll get out the rate tiers. And then the next step in that process is for the organization to look, and if they think by looking at the rate tiers that there could be some pretty good savings, and they see there's We have 14 different plan designs. So we should be able to find something for most organizations. So then the next step is for them to get their employees to go through the process of completing the PHQ. That is.
Can you say what a PHQ is?
I'm sorry, in the insurance jargon.
Yeah.
That's the personal health question.
Okay.
So that is kind of how we underwrite it, the program, and determine what tier is each group. And each group is going to get set. It's not a tier per individual. It's a tier per organization.
Okay.
So that organization, they have their employees go through the process of completing the personal health questionnaire. That needs to be completed, keeping in mind not only the employee that is interested in coverage, but any family members. Biggest thing to remember with that is if you're a father, because we tend to forget things, fathers. We need to have our children's social security numbers
Yes.
we're going through.
Yeah.
The Affordable Care Act requires the social security number for every insured person to be on file. So we complete that. It's about a 10-minute process to complete that. And then while that's being done, then the decision makers at each organization can work with us, Todd, myself, Trent, Don, whoever it may be, to figure out which is the plan or plans they wish to offer their employees. And then we get that process set up. And the ACH form, which is how we collect the premiums on a monthly basis. We get that all in. As long as we have that in by the first or second week of December, people will be ready to go live on January 1st.
Wow.
Yeah.
Sounds easy enough.
It really is. It can sound daunting.
It does sound daunting. Absolutely.
But it's not. And the thing to keep in mind is you have the Keller Fleming team here to support you the entire process.
Yeah.
So you'll have phone numbers. You'll have Terry Gorman's phone number to call if you have questions. You have Todd Nels, Trent Keller's, whoever.
All of which we AOPA team has worked with throughout these months, many months, to really get a good relationship and feel confident about what we're offering to our members.
We're offering, and thanks to you guys, we're offering really, really high quality benefits with great networks, very robust networks that are nationwide networks. So there aren't any programs that are just specific to a geography. So a lot of people don't think about the fact, they get into a program and, oh, this is a regional program. Well, what happens when they have a child that goes to college 15 states away? So this is a program that works throughout the entire country. Has a great, robust network of physicians, hospitals with the one PPO program, any hospital that you want with the reference-based pricing program. So there's a lot of value here. There are a lot of options here. We have little bells and whistles like 24/7 telemedicine.
That's great.
That is great with $0 copay for the member. So
wow.
That's another thing. So it really, and in this day and age where we're still dealing with this pandemic, it makes people a lot more comfortable maybe
it's
to
just
not have to
increases
go to
accessibility.
Exactly.
Yep. Okay.
Well,
Thank you so much for your time. I appreciate it.
My pleasure. Thank you.
So everyone can look in their emails. You'll be hearing much more about this in the next few short weeks, and we're here to help.
Absolutely.
Thanks, everyone.
Thank you. Thanks.